Yo, doctor's in town. Oh yeah, the doctor's in the house, y'all. He's in the house, man. Listen to this, man. He got some good news for you. Hey, man, listen. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house.
Ladies and gentlemen, the doctor is in the house and doing something that I love doing, bringing you up-to-date information that you can understand. Welcome. This episode is a redo of episode 633, and I want to thank Sunny Days over at Rumble for pointing out that the audio was really horrible on this episode, and I don't know how anyone even tried to listen to it. And we did have some listens. We had a couple hundred downloads that day. Episode 633 was labeled Medicine and Marketing and How Big Pharma Profits from Disease. Well, in any case, I do have some notes from that day, so I'll try and recap what my thoughts were. And interestingly enough, today there was an article out about glyphosate, which is Roundup, how that study of over 20 years was ghostwritten and has been retracted. And I have a new podcast, which is a live streaming one on YouTube and Rumble, and it's called The Real Health Rebellion Radio. And I do this podcast with Dr. Jerry Smith and Dr. William Wong. And tomorrow's topic is nutraceuticals, how the big companies have been buying up the vitamin suppliers and producers, and a section on what you should know when you go to a new doctor, what questions you should ask, and so forth. But 2 weeks ago, we talked about publications, and I brought up the fact of the amyloid plaque paper was false. And it led to 20 years and billions of dollars of research and drugs that didn't work. And they didn't work because they were trying to treat the amyloid plaque, and that was a fake study. And here we go. So I'll bring you this tomorrow. We'll talk about the glyphosate. But that's why we started this second podcast, live streaming, so we could bring you the up-to-the-minute news in the medical field. So let's get on with today, and let's see if we can have the audio better, and I can explain how the system that we're involved with, the sick care system, sells sickness. So welcome back. You know, on this podcast, I don't sugarcoat truth. I expose it. And as I said, I already previously recorded this program. But since I thought the message was important, and we did have one listener to point it out to me, I thought I would redo it and maybe from my nose be a little sharper, clearer, and more unfiltered. Because modern medicine has turned into something it was never supposed to be. It's not a healing profession anymore. It's more of a marketing machine. You see, today's healthcare system is driven not by outcomes, but by sales funnels. A funnel that starts with fear, moves into testing, leads to a diagnosis. And by the way, that diagnosis has a billing code and ends with you walking out with a prescription you'll take for the next 30 years. Refill after refill after refill. Side effects of that drug require another prescription, and it's a domino effect. And the kicker of this whole thing is the entire system is designed to keep you as a customer. You'll never hear about any natural therapies, and the natural therapies, as we will talk about tomorrow at 11 a.m. on YouTube and Rumble, they can't make any money out of them, and they're buying them up. So the business model that's out there, and nobody's talking about it, is that medicine is the only industry where people creating the disease guidelines, the companies selling the drugs, the journals publishing the research, and the regulators overseeing the safety, guess what? Bingo, they're all tied together financially. It's not healthcare, it's a vertical integration. And from a marketing standpoint, you would have to say it's pretty brilliant. For example, statins turned into a $30 billion market, not because of groundbreaking science, because of one strategy: lowering the acceptable cholesterol number. Ladies and gentlemen, if you haven't listened to me for the last 7 years, just go back a few weeks ago and listen to the cholesterol derangement syndrome and how they demonize cholesterol. So we have the statin, billions of dollars. ADHD diagnosis tripled when extended release stimulants came out. Bone density testing became common when osteoporosis drugs needed a market. The product came first, the testing came later, the diagnosis was the sales hook. So how do the journals fit in this? Well, medicine markets itself through something the public once trusted: scientific journals. On the Real Health Rebellion Radio, we talked about the 30-some thousand articles that are retracted every year. But what do the journals run on? They run on advertising, reprints, and pharmaceutical money. About 70% of medical research is funded by industry. And because journals profit off positive trial results, guess what gets published? Bingo again, positive trials. Negative trials showing harm or lack of effect, you'll never hear about them. They'll never get published. If they do, they'll get buried. The biggest medical scandal of the decade, the false amyloid research that set Alzheimer's treatment back 16 years. An entire industry was built around a fake photograph. They faked MRI studies. That's marketing, ladies and gentlemen. That is not medicine. That is not the medicine Hippocrates talked about. And how about testing? When you walk into a physician or healthcare provider's office today, every decision is influenced by A, liability, B, is there a billable code? Is this reimbursed by insurance? Hospital protocols. Since most physicians are employees, they have to abide by what the hospital tells them. And the standard of care, rules written by committees that are funded by the industry. So you know what happens? Well, you've probably been through it. You do know what happens. You get tested, not because it helps you, but because it's a revenue stream. So tomorrow we'll talk about the questions you have to ask before you go for a test. CAT scans, especially chest and abdominal CAT scans, expose you to massive radiation. But guess what? They're a $1 billion line item. You know, one CAT scan could be 700 chest x-rays. Most tests are not diagnostic tools. They're on-ramps into the medical sales funnel. Now, you see how this funnel, how it traps you in here? Oh, we're going to get it. We're going to get these scans and see if there's anything we can treat now before it gets too late. But once you're in it and you get on these drugs and you get refills, you're in it to stay in it. And then what do? They have direct-to-consumer manipulation. America is one of only 2 countries on earth that allows direct-to-consumer drug advertising. So why do you think that is? Well, I think you got the answer to that too, because it works. Ads do not sell drugs. Ads sell conditions. What do I mean by that? Well, listen to them. And you'll hear phrases like, do you feel tired? Do you have low mood? Or do you have trouble sleeping? You may have whatever they're selling. You may have fatigue in the morning. You may have brain fog. Just put in there whatever is wrong with you. The goal isn't to tell you what you have. The goal is to make you wonder whether you have something. Believe me, fear and doubt are profitable. Uncertainty drives appointments. Appointments drive prescriptions, and I should have put in here tests and prescriptions. And the nutraceutical industry being bought out. I've discussed this. Pharmaceutical companies purchasing supplement companies. Why? Because the supplement industry is the only sector people still trust. And pharma knows that the future of medicine is going back to natural compounds, mitochondrial support, detoxification, lifestyle changes, epigenetics. So what do? They buy the companies, change the ingredients, cut the quality, market the brand as if nothing changed. Once again, marketing, dominating, healing disappears. So how do you get around this? How do you stay out of this funnel? Ask real questions. Questions that force your provider to step out of the marketing script and actually think. One great question is, what happens if I do nothing? Another one, what evidence shows this test or this drug can improve my outcome? 3, who benefits financially from this treatment? What is the absolute risk reduction? Don't give me the relative risk reduction. What is the absolute risk reduction? And the one big question after what happens if I do nothing, is this treatment designed to cure or to manage? Because anything designed for management is designed to make you a lifetime customer. So, the title of today's episode is Marketing and Medicine, but I want you to hear something very, very clearly. You were not born deficient in pharmaceutical products. You were not born broken. You were not born to be managed. You were born to heal. You were built with biology that is dynamic, adaptive, and regenerative. But the system does not profit when you are well. The system profits when you are dependent. What we do here, week after week, is help you to break that dependency, and we try to expose the sales machine. We return medicine back to its roots. What are they? Truth, physiology, human biology, and healing. Medicine should be truthful, transparent. It should be based on how your body works, physiology, and the biology of the human being, and how the human being does have everything it needs to heal itself if it's provided to them. So I'm Dr. Ron. As you know, if you've been listening, I don't filter truth. I amplify it. And I hope you will look up the Real Health Rebellion Radio. And it is on YouTube, Rumble, BitChute. I have a Substack called Dr. Ron. You can check it out there. That's all new. And this new podcast is to be able to react to conditions the day that it happens. But generally, we will be broadcasting live at 11 a.m. Tuesdays. So thank you. Have a great day. If anything here sounds interesting or you get the urge to pass this on, I sure would appreciate it so we can get the word out. And we'll see you next time. Have a great day.
Hey everybody, Dr. Ron's finished for the day. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. Let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you when the doctor is in the house. So if you have a pain, call the doctor. If you have a strain, call the doctor. Let the doctor know what's bothering you when the doctor is in the house.